Okay, well, welcome everyone. Thank you for attending today. We're glad that you could make it. Today we're here then obviously to speak about what are the Medicare Advantage plans? How are those different from what you currently have?
Okay. Great.
Okay.
Do I hear a kitty?
So basically, we're going to go through and do just a little recap of what you currently have with your Medigap and your Part Ds, what that looks like, and then show you what the Medicare Advantage plans look like. I'm not going to speak specifically to any specific insurance carrier, but I will, however, have some examples throughout the slides that just show you a few different things. And did everybody get their email with the attachments?
Yes. Yes.
Yes.
So if you'd like, you can use that to follow along. There's a little outline in there.
Yeah,
And then I did include just that
Right. Idea.
we
sorry,
do
go
have
ahead.
some new office space here. So we are able to hold in-house seminars now. And then of course, we still will always be doing our webinars. But there is a little evaluation form that I sent in the email. So if you could so kindly just fill that out, kind of giving me some feedback for my own growth, but also too, we're interested in knowing if there are any other topics of interest that you'd like to learn more about, because Nancy and I, as independent agents, we don't just work with Medicare, we also work with life insurance and final expense and a bunch of different other products. So that's listed on that evaluation form. If you could just fill that out and then email it back to us.
Okay.
So as you all know, you have Nancy as your agent. I work alongside Nancy now. I started May of 2021. So I'm newer to the team, but doing the same thing as Nancy as an independent agent, having access to all of those variety of different insurance carriers and different plans. And then we're obviously here on the health side. We also have the wealth side, but on our health, or the health side, we have, this is our administrative team. You all probably have worked with Lauren a little bit. She is actually on maternity leave right now. She will return towards the end of the year, whether it's full-time or part-time, but she does plan on coming back. And then we also have hired Amy, who she started over the summer. Amy's been a great asset to our team, so you will be working closely with her now too. And then Amy's here helping me today with our webinar too. So if you have any questions, she's going to type in the chat too if you want to type anything in the chat box. And then we also have Sherry, who helps us on the health side as well. And Sherry is actually Nancy's sister, and she helps us with a variety of different administrative things, but she only works part-time.
Oh.
So jumping into what you have today. So what you all have today, you've got your Medigap plans. Some of the most common plans are going to be F, G, N, and then we also have the high deductible for F and G. Now, most people who are coming aboard now, if they are interested in the Medigap side of things, we would put them into probably the plan G. That's kind of the best fit right now, because F and actually one of the other letters, but they aren't available anymore to those who are over 65 as of January 1 of 2020. So the Medigap plans that you know and love today, obviously they're coming in and they're helping you pick up the gaps that Part A and Part B expose you to.
Okay. For Medicare A and B. Okay.
Yeah, they all have A and B, and then your Medigap supplemental plan comes in and is helping you with those additional costs that are involved if you were to only have that original A and B. The Medigap supplemental plans, you do pay more upfront. Basically, like you have a higher monthly premiums over there, but you virtually have no out-of-pocket charges when you go to use your plan, right? So when you go to the doctor, you don't have a copay and no surprise bills. The one thing that you do have to meet is you have a Part B deductible. So this year it was the $233 for the Part B deductible that has to be met. And then your plan is coming in and picking up everything else. There are yearly rate increases, which you've probably seen depending on how long you've been on your Medigap plans. So with those yearly rate increases, sometimes people will decide, hey, I'm just paying too much now. I've been on this for 7 years or something. And then they're looking at, maybe I can get into a cheaper monthly premium. So if you want to do that and you want to stay with a Medigap style plan, then you have to be able to answer the medical underwriting questions that each of the carriers have different ones, of course. But we would go through that with you if that was something you were ever interested in. And the Medigap plans can be revisited at any time of the year, but it's just a matter of getting through those medical underwriting questions. And then with the Medigap plans, you can see any doctor who accepts Medicare. So that really gives you the flexibility. So you can travel all over the US. You also have international coverage as well. And then a lot of people really like this style of the supplement plan because you don't have any surprises that are coming in, and you know that you can travel and see any of those doctors that do accept Medicare. So often that just gives you peace of mind.
Okay.
So with the Medigap plans, you also will have to have additional plans, right? So you have to have a separate Part D plan because the Part D is not built into the Medigap plan. The Part D, one thing that I just want to emphasize a few times throughout the presentation is that open enrollment season is coming up starting October 15th, and then it goes until December 7th. And then that's the one annual time of the year when we can revisit your Part D. Now, the other plan we can also revisit at this time, or you can change into, is the Medicare Advantage plans. And then, like I said before, the Medigap, you can revisit at any time of the year. Now, some of the other additional plans that people have when you have your Medigap plans is you might have a separate dental plan. So that's a separate monthly premium, right? Or a separate vision or hearing. Do any of you have the separate plans, like a separate dental or vision?
Yes.
Okay.
No.
Okay, so some of you do, some of you don't. And so you just see that you have like different cards, multiple different cards for the different services. So here's just a good little map that we like to show people because everybody has to have the A and B, right? That's the original Medicare. So we often refer to it as the left side or the right side of Medicare, if you will. So you all are on the left side because you have your original, your Medicare red, white, and blue card with your A and B, and then you have an additional Part D plan. And then you also have your Medigap plan, which maybe you have Plan G or something, right? So that's kind of what we say is the left side, where you have the higher monthly premiums. Your rates do go up year to year, and that's also based on you aging and the cost of living. So you're never locked in at where you start. And then the right side of everything, we refer to that as the Medicare Advantage plans or Part C. So over there, just like on the other side, on the left side, you have to have your A and your B. And then you could pick up the Medicare Advantage.
Okay, I'll go to the
Medicare Advantage plan. And often those Medicare Advantage plans, they have the Part D built in. There's preventative services such as dental, vision, and hearing. So there's a lot of additional things built into how they structure those Advantage plans. So that's what we're going to really dive into to show you the difference between the two. Now, if you, like I had mentioned about the medical underwriting, if you start over here on the left side, and then you want to move over to a Medicare Advantage plan, there is no medical underwriting questions to move over to an Advantage plan. However, if you move over to the Advantage plan and then you want to move back to a Medigap plan because maybe you don't like how it's structured over there, you might have to answer those medical underwriting questions. Now, however, there is a 12-month trial right period when if you want to make that change. So you do have 12 months to move from your current Medigap plan over to an Advantage plan. Give it a try if you're interested. And then if you decide you don't like it and you'd like to go back to what you had previously, you will have to enter into the same exact plan that you had previously, or you have to answer the medical underwriting questions. And that's called the trial rate period. So some of the built-in things, if you will, with the Medicare Advantage Plans, Part C, there are many plans out there, many carriers that now have a $0 monthly premium on these plans. So it's built a little bit different. So you pay as you go. So when you go and you use a service, you do have a copay. Now, most of the plans, if you go to see just your primary care physician, they do have a $0 copay on that one. But then when you go to see a specialist, it could be maybe say $45 when you go. There's all different. It's kind of built maybe more like a group plan that you previously were on, where you had those copays or co-insurances. Most of the plans do have a $0 medical deductible as long as you stay in network. And that is going to be one thing that I also am going to talk about a lot, because on this side of Medicare, you really do need to stay within network. If you don't stay within the network that's built in with the plan, then you're going to pay more. All of these plans have a max out of pocket, where on your current plan, you obviously don't have that. The max out of pocket will vary by plan and by insurance carrier. But for example, one of the popular plans for this year, for 2022, the max out of pocket is $5,000. Now, the max out of pocket is obviously the worst case scenario of what you would potentially be paying, but your copays and your co-insurances will be feeding that max out of pocket bucket. However, your monthly premium, if you do have a monthly premium on the plan, and your prescription drug costs do not feed into the max out of pocket bucket, if you will. And then the monthly premium, it's going to be based on where you live. So we always look up the county and zip code, because also too, some of the plans are not offered in every county. So that is one of our first steps of what we would look into if you were interested in this. And again, it's all about the network. So we'll be talking to some examples in the coming slides on that. All of the Medicare Advantage plans, they're rated by the Centers of Medicaid and Medicare. So every fall they come out with the new ratings, and those star ratings are rated 1 through 5. And this year actually was the first year that there was ever even a 5-star plan. So most of the plans are like 3.5 to 4.5, but just this year we finally had a 5-star plan that came out. And then some of those network choices that you have. So it's either going to be a PPO or an HMO POS. And so just kind of what that means, like the PPO. So those are the plans that they don't require any referral to see a specialist. You get the most value for your plan when you're using in-network providers. But that does not mean that you can't go and see another provider who participates with Medicare. So you maybe would just pay a little bit more, but it gives you that flexibility so you can see out of network. And then the HMO POS type of a plan, you can use providers that are within the network, and of course you'd be paying less, but that POS portion allows you to use the out network providers both within Michigan and across the US. So if you are out of network, again, too, there you would be paying a little bit more potentially, but giving you some flexibility. And then back to that open enrollment season. So it's either the Part Ds or the Medicare Advantage plans that we revisit during open enrollment season, which just start October 15th. Now, Nancy and I are getting all ramped up right now with all of our recertifications for 2023, and actually starting October 1, her and I can start speaking about the new plans with clients. So we are making appointments already starting on the 1st. So if you are interested, it would be good to get something in the book soon because we are filling up already. And then some other, a lot of the plans, most of them all have the Part D prescription drug coverage built right in. So instead of having that separate card and that separate monthly premium, along with maybe having to meet a deductible on that, the Part D for this is built right into the plan. It comes with the worldwide coverage for emergency or urgent care services. So whether you're here in West Michigan or you're in California or overseas somewhere, you can still be receiving your emergency and urgent care and paying the same copay that you would here as if you were out of the country. Some of the included extras that are in these Advantage plans are going to be the preventative dental, vision, and hearing. And then they also include an over-the-counter purchase, and that depends on the plan, but it generally is like an electronic card that they deposit money onto, and money gets deposited every quarter, and then you can use that money on different health and wellness items that are approved at different stores. They also send out a catalog, and I'll talk a little bit more about that. Another feature of the Advantage plans is they offer a health club membership. So lots of different places that you can go, and they cater to all levels of exercise. So there's something for everyone.
Silver sneakers.
Yep. Silver sneakers. That's one of the ones that I will speak to, because that's one of the popular ones that a lot of the carriers do use. So then what are those embedded benefits, the preventative benefits look like? So this is just an example. Not all of the plans are going to work with this network, but this is one of a popular one. So I just wanted to kind of show you, if you did have this style of a plan, this is what the dental is going to cover. So you're going to get those 2 dental cleanings, 2 exams, 1 bite wing x-ray, and the brush biopsy per year. Now, again, it all goes back to the network. So if you were interested, we'd want to know your dentist, and we'd look it up to make sure that they would participate in this Delta Dental network, or it could be another network too. Like this is just an example solely, but same for the vision. So if we look down, it's going to be iMed for this one. And we just would make sure that your doctors do participate so that you can get all of these benefits. And then there is also too, like the hearing that's built in, and they do offer different affordable options with hearing aids and batteries and all kinds of things like that. So while they have that built-in preventative stuff, you can also do an enhanced dental and vision options. And that's just going to be like a little bit more of a beefed up plan that you can only add at certain times of the year, similar to if you wanted to make the move from your Part D or from Medicare Advantage plan. So it's going to be, again, that open enrollment season from October 15th to December 7th, and then that would be effective January 1 of that following year. There is, however, a grace period. If you were to move into the Advantage plan and you didn't know if you wanted the enhanced dental and vision, you do have an option to add that on in January or February. Otherwise, outside of that, you would have to wait until the next enrollment period. And then the other option is when you're first aging into Medicare and you're first coming aboard, you have, some of the plans are 30 days and some of them are 60 days, but this specific one was within 60 days, you could still add on that additional enhanced dental and vision. So this is, again, just examples because I didn't want to be anything specific to some of these carriers, but this is just what some of the enhanced dental looks like. Now, let's say you have a $0 monthly premium with your Medicare Advantage plan, but you want to do the enhanced. It could be anywhere from $23 to $32 extra per month. So then that basically would be your premium on the plan. And again, it's all about remaining within that network. It does include the basic dental services. And then when it comes to the major dental services, they cover at 50%. And then depending on if you have a current dental plan, like a separate one right now, when you first come aboard with those separate dental plans, usually they cover at, say, like 30 to 40% for the major dental services. And then at year 2, it bumps up like, say, 10%. But so basically it's like the longer you're on the plan, the better coverage that you're going to get, where these ones, this is where they start at 50. And then they do have that yearly limit per calendar year. And just one example with this one, it was that they give the members $2,500. Some of the vision enhanced, the dental usually is the one that they really beef up, but then vision, they do give you a little bit more. Again, all about that network. So for this specific example, it was the iMed network that you'd want to stay in. The plan already offered, we'll say, this $100 embedded vision benefit that you could use on frames and lenses or contacts. But then the enhanced ended up getting this particular member $150 extra. So they're able to have the $250 to use over the year. And then some of the other items that I would say the Medicare Advantage plans are really trying to do is they're just encouraging a healthy lifestyle. And like someone had mentioned, the silver sneakers. So that is one of the popular ones where you get this at $0 cost. You can go to all these different gyms who participate with silver sneakers. And you can even do that anywhere in the country because silver sneakers is all over the place. So that's a nice thing if you are someone who travels often, or if you spend a good chunk of time, say in Florida or Arizona for the year. And then the silver sneakers, I mean, they have additional benefits to it too. They have a tuition reimbursement program where you can have like a grandchild or even a distant family member who you pick as your beneficiary. And as you go and you're working out, you're earning points, which equal out to be money for their school. You of course have to make sure that there's schools on the list, but there's tons of schools, colleges and universities that are listed on there. So another nice little enhanced benefit there. And then they also do the Brain HQ is on a few of the plans. This is just like a personal gym for your brain, if you will. They give you daily exercises and little games that you can play. So basically just to exercise your brain and keep you sharp. They also have telehealth services. So this one is the Health Club for Your Mind, the My Strengths, where you have access 7 days a week to licensed therapists from the comfort of your own home. And then some of the plans offer a variety of different sessions for acupuncture and then chiropractic services as well. Now that over-the-counter benefit that I spoke to, so it's kind of like this little card here, you know, like a little gift card where they electronically are depositing that money on quarterly. Right now, the way that the plans have it built, it's a use it or lose it system. So if you get, say, $50, one of the plans has that. So it's a $50 benefit that goes onto your card and you can order online. You can call in. You can even go to some of these stores here that are listed. And you can get all different types of products, like the vitamins, Band-Aids, toothpaste, bug spray, sunscreen. They even have different like assistant items, like if you need a shower bar or things like that. So lots of stuff covered in those catalogs. So it's definitely something we like to make sure that our clients know and they're using, since the money will expire if you don't use it. And then they also do the food savings. Basically, it's going to be like a weekly ad that you can check out to see. I think Walmart is one of the big stores that does it. And there's a few other stores on there too, but they just allow you to get different discounts on healthy food items. This is a little bit newer, the meals that they're doing now. One of the programs is called Mom's Meals. And basically you can get, after following a discharge from an inpatient or a psychiatric hospital stay or skilled nursing stay, you can get up to 14 meals in a week. They'll come to your house, delivered, and they're ready to be reheated. You can usually, most of the plans right now do 2 weeks. So you can get 28 meals within 2 weeks. They do cater to dietary needs. Just kind of a nice thing for if you're coming home from the hospital recovering and one less thing to think about, you have some meals ready to go.
Oh my God.
And then it's like your Part D that you have now. The Part D is built into the plan over here though, but just like your current one, you can still do mail order. They do the 90-day fill. We always recommend you to do the preferred pharmacy over the standard. And even if you have an expensive drug right now and you're not familiar with it, we always want to remind you of goodrx.com. So you can always look up any of your drugs that you're taking and you put the drug in, the dosage, and then it'll come up with a whole list of different pharmacies. And sometimes it's actually cheaper to use the GoodRx coupon versus going through your current plan. So that's why I just added that little part. And then on the Advantage plans, some of them do, obviously it varies by plan, but they have select insulin coverage. So they have some great savings where every time, say when you go to fill your insulin on these select ones, it could be at $35, but it's never going to go up over that. So that's just an example. And then on this side, the Part D, there is still a donut hole. So there's a donut hole in what you currently have, and then the donut hole over here as well. If you get into the donut hole, then you pay 25% of the retail cost of the generic or brand name.
Could you repeat that donut hole reference again? That's with the Advantage plans, or?
Yep. So that's actually going to be with both. So the donut hole, I'm just saying it exists on both sides. So it exists in your current Part D, and then it exists over here on the Advantage side as well.
Oh, okay.
So once you've reached that, or they also call it the coverage gap, then you pay no more than 25% of the cost of your plans covered the brand name or generic prescription drugs. And then to the Medicare Advantage plans, they use the same kind of like formulary as what you have today, where it's like based in tiers. So they all have a tier. Usually it's like tier 1 through 5. But it is similar to what you have today. Now the Advantage plans, they also now have come aboard, and they want people to know that they can travel outside of their area. Apparently a long time ago, the Medigap plans were the ones that allowed that, where the Advantage plans didn't, but then they decided we need to get on board with this. So there is the worldwide coverage at the in-network pricing from the Medicare participating provider. And then they also, some of the carriers have different additions on these like snowbird deals for those individuals who do spend a good portion of the year in Florida and Arizona. And that too, if that was something you're interested in, we could talk specifically about a certain carrier to see if it was something that you were interested. Now, another neat program is the Assist America, and they don't all use it, but some of the companies do. And the Assist America is basically a global emergency assistance when you're at least 100 miles away from home. So if something happens and you are, just say you're in Germany and something happens and you don't know where to go, where to fill a prescription, or how to find a doctor, you're struggling with any of those items, you just call them Assist and they will help you navigate all of that. They can even help you if you have lost luggage. I mean, they really are a pretty neat program.
That's with the Advantage plan.
Yep, that is with the Advantage plan. Yep.
Okay.
So kind of is just the overview of what the Medicare Advantage plans look like and how they're built. Basically, Nancy and I, as your agents, we just want you guys to know exactly what your choices are. So that's why we were holding this. We had an in-house seminar and then obviously the webinar today too. But we just want you to know that there are other choices. And I don't know, maybe if you have friends or other family members who have the Advantage plan, it's just good to get a little education on it and see if you are interested. There are so many built-in benefits with it that just are no cost to you. So even our people who are on the Advantage side, we do another seminar for them so that they remember all of the built-in benefits. And then if you are interested in reviewing even just your Part D, say you want to stay where you are, if you want to revisit your Part D for open enrollment or even look at the Medicare Advantage side, I just would suggest to give us a call so we can get an appointment set up because we are already starting to book those up. But you have all made great choices in your current plans that you have. Again, we just want you to know what all of your choices are. So do you have any questions at this time?
Kristin, I just had a kind of a generic question. I'm
Sure.
just going to put it out there. I don't know how much definition you can give me. I still work. I'm a public guardian, and I have a client who's got an Advantage. He's got the Priority Health Medicare Advantage, and I just get every once in a while I get these explanation of benefit statements, and it just seems like there's an assigned amount and what the doctor accepts, and then there's quite a gap. And it's not a bill. It says this is not a bill. It's just an EOB. But I'm just kind of curious, would that get? Do you see that in your practice, or I'm just curious if you can speak to that about the gap, or is it just it's there and the doctors just take what they're going to get, or I don't know if you have any commentary on that or not, but.
Yeah, so you're saying that it's a gap, but it's not a bill?
Yeah, it's
statement.
a mailing I get, and it'll say explanation of benefits. This is not a bill.
Yeah, so they're just breaking it down to show you probably like what the plan is picking up and what the costs were.
Yes,
Yeah.
It is.
Yep. Nope, they will do that.
It just seems to show a deficit, and it's just curious to me. Well, we've got this deficit. Does that just it is what it is, and
yeah,
I don't know. It's kind of a theoretical question. I know. I don't know.
Yeah, no, that's okay.
No, we've noticed the same thing. You'll say the doctor billed $250. Medicare has approved $200, but they only pay the doctor $150. And we always think, what happened to the rest of the money? I don't understand.
Yeah.
Some of it is picked up by our Medigap, but there's still money that is not covered, and it just doesn't. Trying to figure out the EOBs is a struggle, but
it is.
Yeah.
I guess the doctor just takes the hit, right? He's going to take, if they participate, they're just going to take what they get paid.
And then too, part of the Part B too is also going into that amount as well.
Yeah,
Okay,
But it is interesting.
I think the way it breaks down, there's an assigned amount, and Medicare Part B, which is the medical coverage, it's an 80-20 breakdown. So they'll pay 80% of the assigned amount. And if that doctor bills something above that, well, all they're going to pay is 80% of the assignment, not what, and some of these doctors used to participate with the assignment and some didn't, it was always, I don't know.
Yeah, and then the supplemental plan will hopefully come in and pick up the rest.
That they will pay. Medicare has contracted certain amounts that they will pay for certain procedures. Medicare says you may charge $50 and you can put $50 on there, but we're only going to do $20. So it is a matter of what they contract as to we will pay.
There you go. I just had another question, Kristin.
Mhm. Sure.
At the beginning of your presentation, you referenced that some of the Advantage plans were like 5-star plans.
Yes.
Could you delineate which few plans that are classified as 5-star or?
Well, so right now for 2022, they're the Blue Care Network. They're the ones that have the 5-star plans, the Medicare
Okay.
Advantage plans.
Very good.
Yeah.
And you still have to pay if you're.
I have a question.
Yeah.
And I believe okay. I know when we have our Medigap plan, Social Security takes out of our Social Security, their premium every month, which is $170.10.
Mhm.
Is that also taken out when you have a Medicare Advantage plan?
Oh,
Yes, because you always have to be paying your Part B. So it'll still come out the same way. It'll still come out of your Social Security check.
There's different kinds.
Okay,
There's-
and I know with the Medigap plan that we have, the hospital, what is it, like $1,500? And you go into
Their HMO plan.
that is being covered by my Medigap plan. Is that covered by Medicare Advantage?
Yeah, sorry, I was picking up somebody else talking too. Can you just
Okay.
repeat that last part?
When you go into the hospital,
Mhm.
there's like a $1,500 copay that you have to do, like every time you go into the hospital with Medicare. One on
Right.
the GAP plan that we currently have, that is covered. That is
Right, it
paid
picks
for
it up.
by- does the Medicare Advantage pick that up as well?
Yes.
It does.
Yes.
Okay.
Now with the Medicare Advantage plan though, I will say, so while it comes in and it picks up that exposure that you have, and that actually falls under Part A, that
Mhm.
amount. As I mentioned, how it's kind of like a pay-as-you-go type of a plan. So they base it then on days that you're there. So say you have a certain plan and it's, you're gonna be in the hospital, you're there 5 days. So then all 5 days, you're gonna pay, we'll say $200. And then after that, if you're there over 5 days, then the plan picks everything up. So that's kind of how they do that. And then that amount feeds the max out of pocket.
And each Medicare Advantage plan has a different max out of pocket.
They
They
do, yeah.
Oh.
It kind of depends. I'd say the average is about $5,000.
That is the average, 5,000. See, what we had always thought, and we've had our Medigap plan for several years now. For example, myself, I pay in premiums $1,600 a year. And I always thought, I'm not going to switch to a Medicare Advantage plan until my premium gets close to what I have to pay in, my maximum out of pocket. I know that there are other things, I know that now there's the dental and the hearing and
Yeah.
there's, but that doesn't, I don't think, add up in benefits to the 5,000 that I would have to pay out of pocket. Does that make sense? Or
No, that does make sense. And it is obviously like worst case scenario, paying that full max out of pocket. Most of our clients don't ever reach that max out of pocket, but if they do, it's generally like they've been diagnosed with cancer or something like that. And so
Or-
that's how then they reach that. And then the plan comes in and picks everything up.
Well, like my husband was in the hospital for 19 days with open heart surgery. There you go.
Yeah.
And then we also have multiple doctors, there's a sleep doctor and there's a cardiologist.
Yeah,
And so we would probably get up there pretty quickly. And this way, it's like I pay nothing, I come home.
right.
Okay. Just want to make sure that I'm not oversimplifying.
Nope, I think that you are understanding it. And like he was in the hospital for
19 days.
19 days. Okay, so on most of the plans, just on an average, it's anywhere from like 5 to 6 days that you pay that. It's like some of the plans that have like $200 to $300 per day for those 5 to 6 days. But then after day 6 or 5, then the plan comes in and picks up everything. So that's all that you would have to pay on that.
Okay.
Yeah,
And
so
this
it's
is-
not like each each day, times 19.
Okay. And as far as the donut hole, there's like a figure going into the donut hole, and when you reach the number, you come back out of the donut hole. Isn't it like 4,000 going in and 7,000 coming out, something like that?
Yeah, yep. And it's like 4,000 and something, a few hundred, and every year it changes too.
Mhm.
It generally goes up a little bit, but yes, you are right.
Okay, all right.
Let's do the advantage. Do they call
Yeah,
that?
does anybody else have any other questions right now?
Yeah.
Does the Advantage plans cover chemo type drugs?
So usually those types of drugs are going to be billed through Part B. And then it just depends on what you're getting. But if it's like an infusion or chemo or something, then that's going to go through Part B.
Okay.
Anything that you have to have administered, that will go through Part B.
At
But
medical.
if it was a pill, then it should go through your Part D that's built into the plan.
Oh,
Or
okay.
vice versa, your Part D that you have right now separately.
Okay. Okay.
Yeah.
Okay. Great.
Just curious.
Well, yeah, no, absolutely. We like all the questions. So if you guys do have any other questions or think of anything else, you can always feel free to give us a call or email us. And then
And we can schedule with you or Nancy and have a sit down appointment and
Yeah.
look at some of this in more detail.
Yep, absolutely. So come October 1, that's when we can first start talking about the new plans for the Part Ds and the Medicare Advantage plans.
Okay.
October 1. Okay, very good.
Yeah,
great.
so if you
Thank
guys want to
Very
call in and
interesting.
let us know, we can get something scheduled.
Okay.
It's complex, isn't it? Boy.
Thank you very much.
It is, but that's why we're
Kristin.
here to help, hopefully to simplify it a little bit for you.
You guys do. Thank you.
Thank you.
Yeah,
Good.
we appreciate
Good job.
it.
Thank you. Yeah, and if you have time to fill out the eval form, that'd be wonderful. You can just email it back.
Okay.
Just give a little feedback, but yeah, if you
Sure.
think of anything else, let us know.
Okay,
I'm all over everything.
Thank
All
you.
right.
Indeed, we
Okay,
will.
thank you.
Well,
Thank
thank
you.
you. Everybody enjoy the rest of your day.
Thank
Okay.
you.
Thank you
Okay,
too.
thank you.
Bye.
Bye.